Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We're coming to you from the Alan B. Levan Innovation Center, which is a combined element of cooperation between Broward County and Nova Southeastern University. We're very proud of it. And today we have a very special guest, someone who is very well known in the field of, shall we say, medicine in general, everything from she's going to tell you, but she's obviously one of the state of Florida, and if not the nation's great child advocate. And she's a pediatrician, amongst her other areas of medical practice. But one of the wonderful things, and I always take great pride in when I introduce her, to tell you that she was the first woman ever to be chair of the Florida Pediatric Association. So welcome, Dr. Deborah Ann Mulligan.
Good morning, Dr. Lippman.
It's nice to see you. We have, this is a time of the year when all of our children here in South Florida, don't forget we go all the way from the Keys all the way up to halfway up the state on public television. We know that the parents are preparing their children medically for their back-to-school physicals. So I'm going to ask you to enumerate what you think the folks that are watching this show should be doing, and what should their responsibilities be as parents.
Okay, so I'm also, as you said, I'm board in pediatrics, but also emergency medicine. And so I'm going to be thinking in terms of, well, childcare as well as injury prevention. So if we look at the different kind of physicals that are going on right now, there's going to be the sports, right? Are you ready to participate in sports physical versus the annual school health physical? They're very different. So here's the difference. School health physical looks at mind-body connection, right? So we're looking at mental health, social health, physical health of the child, family history. Is there diabetes? Is there hypertension? The shots, what are the immunizations that the child needs or has already up to date? And when we do the physical exam, reviewing all those areas for the child, then a form is filled out. And in certain age ranges, there's also tests looking at iron level, lead level, cholesterol, diabetes, depending on their age and where they live. And to your point, here at the clinic, I just had a child from Sunny Isles. So they come from the entire South Florida to our pediatric clinic at Nova Southeastern. Now, the difference in sports physical is we want to know, can they participate in sports? Are they cleared for that? So in those instances, we want to know more about not only the physical exam, but in addition, just like in the school health, vision. What's their vision? Are they going to be able to see the ball coming their way? Do they have good hearing? Again, same as school, but the difference is going to be, have you ever had a concussion? Do you feel dizzy when you're participating in sports? Have you ever fainted? Have you ever had a concussion? Those kinds of questions are really important to know whether we have to evaluate the child's heart or lungs to see that they're fit and safe to participate. We just saw LeBron's child, young adult child, have a cardiac event playing basketball. That happens. It's not common, but it happens. And that's why we screen the kids for sports, looking at heart and lung. And then, of course, the shots. But mostly it's looking at participation. If they have seizure disorder, we're not going to clear them to do mountain climbing or skydiving. That would not be wise. But kids with seizures can certainly play rugby, football, soccer, and so those are the things we look for.
I was going to get to these sports physicals a little bit later on, but since you brought it up, I always tell our viewers, and really these shows are created by the questions that have come from our viewers over the last 24 years. I don't know, we're well over 500, close to 600 shows, and they all come from questions from the people who view us. And one of the big questions has been they were shocked at seeing the professional football player, fall on the field, and then of course LeBron's child, his basketball son. So it's renewed their interest. I know that we at Nova Southeastern University, with a great number of athletic programs that we have, both male, female, etc., we require the full physicals and also historical data. We ask them from their pediatricians and their probably whatever other physicians that care for them during their period of time of getting to be 17, 18, 19, 20 years old. And I think that the public is very interested in that, because to see what we envision as an American citizenry, as the prominence of all these sports activities, and then see something like that happen, it becomes very shocking.
It's scary.
It's very serious. Is there any, do you pick up, I'm sure, in your professional work, that you pick up some issues which maybe might have to be referred to a cardiologist or a nephrologist or something of that nature? Is that true?
Yes, absolutely true. I can think of a young man, 16-year-old, who was in our clinic not that long ago to get his sports physical clearance. And during the exam, we could hear an unusual heartbeat. So we did a preliminary electrocardiogram, and sure enough, he had a little bit of an abnormality. So of course we didn't clear him, and we immediately sent him to the cardiologist for a full workup. And so that's the beauty of the differences in the sports physical versus the school annual physical, is the detail looking at, for sports, head injuries, cardiac, pulmonary, to make sure that the child is in the best shape to be able to participate and enjoy life playing for their school.
You might remember, of course, we all honor the great doctor from University of Florida. Who am I talking about?
Dr. Jerry Schiebler, he's a cardiologist, isn't he?
Schiebler, who played an important part in your professional life, and played an important part in my, shall I say, elected representative life. And one of the things that we accomplished was the requirement to do testing at term, at the delivery of the child. As you know, there are a lot of tests and things that go on. The only thing that we could not do is obviously deal with the eyesight, because it takes a good 3 years plus for the eye to matriculate it in its responsibilities in the body. And it's always bothered me, and I'm sort of saying it out to the audience, they've heard me say it all the time, that kids end up in preschools or even kindergarten, and they have certain eyesight issues. The bottom line is we have two wonderful programs here at NSU. We have the audiology program for hearing, and we have the optometry program, which it's recognized by multiple major eye care centers in the United States for children or pediatric eye care. Yes. So could you talk a bit about that?
I wanted to make sure you heard that while we were at the FMA annual meeting, just under 50% of all practicing physicians in the state of Florida all specialties belong to this organization. And we were talking about you, Dr. Lippman, when you served as a legislator, because the public may not know. The reason their hot water does not exceed a certain temperature, which would scald their skin, is because of you. So safety on hot water in the homes. safety in the cars, right? With the seat belts and the car seats for kids, which we should touch on in a moment about transportation for kids to school. Also, for firefighters, covering the care when they're exposed to infectious diseases they weren't covered before. And then we at NSU created for EMT paramedics, the pediatric education for pre-hospital providers. We did that here in collaboration with the California EMS project. That is now international, to your point, but it started right here. And many states require that for education of taking care of children with the paramedics, including our own. So that's all true. You're speaking to the choir about eyesight. I don't know if you remember, I was born with crossed eyes. So I've had 2 operations as a child to get them to look straight, but I can't do depth perception because they don't work together. And so to your point, it's so incredibly important to catch these things early and be able to provide care to the children early. We also have sports medicine optometry here. And just as an example, I had my examination 2 weeks ago there by one of our sports medicine optometrists because I like to golf, Mulligan. And it was incredible. I've never had an eye exam like that in my entire life. And so I advocate strongly for anyone who needs eye exams, whether it's to do better at your tennis, or what's that thing that people play now to get injured? They're over 50. What is that? Pickleball, golf, tennis. We have sports medicine eyesight in addition for children. And then to make it even stronger, the integration of those programs, while we're here at the clinic, more than once, I've had a child who failed the hearing exam here, and we literally just walked them next door to the audiology department where the audiology experts in pediatric care did a comprehensive evaluation of their hearing to better understand what the needs of the child would be.
There are some great children's hospitals in our state of Florida, great children's hospitals.
Just outside my door here is a resident in pediatrics from Broward Health that I'm working with today. So we have the Children's Hospital of Broward Health, Joe DiMaggio. There's at least 40 now in the state of Florida. You're right, they're all great.
Yeah, we're, I would say, fortunate. I never use the word lucky, fortunate, because we've paid a lot of attention. A lot of, people, when they think of the state of Florida, and rightfully so, I understand, because, nearly 70% of our population is over the age of 50. And we have the highest number of people over the age of 70 of any state in the union, and we have, percentage-wise, and we have the highest number of people over the age of 90 living in the state of Florida.
And still driving cars.
Yeah, and still driving cars. And so they may not be interested in the pediatric side of this, although that's unfair to say, because they're all grandmas and grandpas or aunts and uncles, and they do care about it. But, you were very kind to enumerate the things that I had the privilege to work with wonderful people like Dr. Schiebler and others to get some things done. To get on to school physicals, I think it's an imperative. It's an imperative because most people don't realize that many of the imperfections that we as human species have, which are built into us either by genomic direction or otherwise, can be seen prior to adulthood. Am I telling the truth?
Oh, yes.
So it's in your hands.
Oh, well, in the minutes that we have, I thought maybe if it's okay with you, we could cover the 7 S's, list of 7 S's for parents to think about. So sleep. We may be traveling to see family and friends in different time zones. Maybe you let the kids sleep in a little later. Really good time right now in the first week of August before school starts to start changing the time they go to bed. Just like, 15 minutes a day for every few days, change it up so that at the end, they're comfortable when they go back to school. Most kids need around 10 hours sleep, plus or minus, depending if they're teenagers or younger. Screens, they've probably been enjoying watching all sorts of movies or, the Olympics or, hey, the Golf Channel maybe. And so we want to make sure that they limit their screen time. There's been a brain drain over the summer, so maybe you want them to start reading up on something that's really interesting to them. If they were watching the Olympics, maybe they read about the history of the Olympics. If they're a big Messi fan, maybe they read about Messi. Maybe they read about soccer. Something that they like, just to get that brain back going again. Sugar and snacks. We let them have a little give over the summer, maybe eating a little bit of sugary things. So we want to start getting them used to eating healthy foods again. If you have been letting them eat a little bit too much sugar, remember, 1 can of soda is 10 tablespoons of sugar. So we want to get them back into healthy snacks. The fourth S, shots. If they don't have their immunizations up to date, make sure that you get an appointment with your pediatrician so that you can get that taken care of before they start school. And as you mentioned, different parts of the country, even, for example, California, my native state, is mandatory to have shots. We are not, but you still need to check on that for your school. Supplies, the backpacks, you want to make sure that the backpack isn't weighing 10 to 20% more than the kid's body. So always check and take things out they don't really need. Make sure they use double straps. If you can, get the biggest weight in the middle of their back so they're not getting neck and shoulder pain. And then, study space in the house. Nice quiet spot, no screens, where they can do their homework every day. And then stress, it's, if they're in a new school or they've never started school before, it's a great time to start talking about what fun it might be, or finding another kid in the neighborhood if you just moved that he or she played with over the summer, to be able to go to school with them. Transportation, if they use a bike, wear a bike helmet. Maybe you want to ride the bike with them to be on that path, to make sure they understand to be on the right side of the road, follow all the rules like everyone else. If it's a walk and they're young, you could do a walk school bus, right? You can have a bunch of kids with one adult who walks them to school every day. If you want them to walk to school, they should really not be younger than 9 or 10 years old. And you should walk with them the first few times, just to make sure that it's a good area for them to be walking and that they understand what they should be doing. Teenagers, you don't want them texting and driving, right? What else, Dr. Littman?
Well, I'm glad you brought up the texting, because I'm going to just go back a bit on what you just enumerated. I've had this discussion recently with, actually it was a College of Osteopathic Medicine leadership group. It was the leaders that represent the students. And the issue of cell phones came up, I said, I understand the purpose for you to have contact with your friends and parents and others, sometimes some of the professors, whatever it is. But if you think of your little brothers or little sisters or otherwise that are going to bed, and all of a sudden you think they're sleeping, but they're underneath the covers and they're using their cell phone to talk to friends till 11, 12, 1 o'clock in the morning.
So you're right. A few things on that. It's really good to have a phone-free zone in the house. So kitchen table, when people are eating dinner together, no phones. Have a basket, put the phone in the basket if you'd like to do that. That would be a phone-free zone. In the bedroom, phone-free zone, because to your point, that blue light can be, it can trigger change in your circadian rhythm. They won't get that good rest that they need. Or even just staring at it a lot can cause stress to the eyes, going back to vision. So really nice to have. I'm happy you brought that up for phone-free zones. Yeah, no, you're right. And then sometimes kids will be texting each other at the table because they want to say things to one another without their parents hearing. So yeah, I've always, for my kids, I've always maintained that the family dinner table is a phone-free zone, because that's when you get to ask them, how was your day? And even when you drive them from school, if you drive them, find out how their day was. Did you meet any new people? What were your friends like? Did you run into any troubles? Because, that happens too. And it's important for them to feel safe to talk about whether they were bullied or they saw somebody bullied, they don't know what to do, they're seeking advice, or even having a great day. So either way, it's important to connect with your kids and have that communication open so that they feel comfortable no matter what they want to share with you.
Well, I always tell people near the end of the show that they must communicate with their doctors. Don't walk into a supermarket or a pharmacy or anything and pick something off the shelf and, this is going to take care of my ache, this is going to take care of my headache, and this says it's going to be good for this or that. You have to communicate with your doctors. Don't hide what is apparently, you think, a minor issue from the doctor. Now, I know it's difficult because we have, concentration of venues, and sometimes it takes a week or maybe even 15 or 20 days to get an appointment, and I don't say that everybody is like that, but it does happen, especially with subspecialists. And I'm not denigrating them, it's just a reality. I mean, we're not producing enough physicians in the state, in the United States. I mean, we just happen to be lucky, I don't want to say that, fortunate, that in the state of Florida, we have some of the finest hospital and healthcare venues that can be found. I mean, I love the hospitals in Massachusetts and in very different places. I don't want to talk about names, but we have that capability here now. And I implore, I beg our people that watch us, don't just put it off. You have a problem, talk to the doctor. Is that correct?
Absolutely. Absolutely. And everything is meaningful. Sometimes people will not realize that a symptom, to your point, or something that happened to them over those weeks that they were waiting for the appointment is important for us to know. And so feel free to share everything because we want to be able to get that jigsaw puzzle box and put all the puzzle pieces together to come up with a good diagnosis for you and take good care of you.
Well, we're down to the last 2 minutes of this show. So I'm going to give you the opportunity to take a minute and say whatever you want to say.
Well, I would say it's been a tremendous personal honor being on your show here and there over the last 21 years. I know you've been on television for 24, so I'm so grateful that you invite me back. Help your kids have fun in school. It's such a great time in life, and anything you can do to keep them healthy, happy, safe, we're here to support you on that.
Well, thank you, Dr. Deborah Ann Mulligan, a child of the San Francisco area. How about that? I included the whole, all 3 counties, all right? But it's been a pleasant opportunity to work with you over the years with people like Dr. Shiebler and others. I don't want to leave anyone out, but we've lost some of our dear friends, and but it was never based upon a political spectrum. It was based upon what can we do to protect children, and you were part of it, and I want to thank you. So, folks, remember, a lot of it is in your hands. As I said, you have to talk to your physicians, particularly the pediatricians, because you can bring an easier life to those children as they grow up if you get to the pediatricians for what I would say at least twice a year. At least that's what I've been told. So remember, this show is called Dateline Health. We have a telephone number and an email address right here. If you have any questions, we've passed them on. I don't answer the questions, but I really appreciate you giving us the opportunity to focus in on the back-to-school physicals and on pediatric and child care. Again, my name is Fred Lippman, and till the next time, see you.